make sure. I know how it works. So I will say block 1 is going to be very different than block 2, which obviously we're not there, we'll talk about. There is a lot of rote memorization that I'm going to need from you guys for this block. There's stuff that's just, you gotta know it. There's a lot, you can't reason your way through some of this, it's just straight facts. So we'll go through some of these, kind of a 3-part review, just for some different learning styles. So at the beginning of all of your lectures, I put I'll start somewhere first here. So first, what I need you to know, when you are going through everything, please be able to distinguish normal versus not normal. So if there is a normal version of temper tantrums, be able to distinguish what is not normal. Or if there's a normal newborn baby exam, be able to explain what is not normal and be able to pick those out based on descriptions and then treatment. What would you do if it's normal or not normal? Okay, so that's going to be the biggest thing. Can you distinguish that? And with that, then what's going to make it become abnormal? Is it the age? Is it the longevity of something? Is it the underlying etiology? How are you distinguishing that? If same with a physical exam, if I give you the physical exam findings, are you able to get the diagnosis and then be able to say what is normal, what is not normal? So we'll look at some example questions a little bit. And then if it's not normal, that second order, what do I do about that? Does that need a screening test? Does that need a referral? Does that need a medication? What is your secondary treatment from that? So if you go through at the beginning of all of the lectures, which I've just done it for you again, which is fine, but there are 41 objectives for block 1. So there are 50 questions on your test. There are 41 objectives. So yes, there's going to be some stuff that is hit more than others, but study based off of your objectives on that, because that is how I write it. So if we're looking at lecture 1 and 2, that was your normal newborn baby. What do I do with that newborn? And then lecture 2 was what is the abnormal for the neonate. So again, what's your normal exam look like? What does your abnormal exam look like? Can you score an APGAR? If I give you an example of this baby comes out, can you score that APGAR? What happens at that immediate after versus what happens 24 hours later? And what do you do if that is missed? So what do you need to do for that? What were those normal newborn reflexes? When do you expect them to go away? What would happen if they persist? And then block 2, lecture 2, was all of the, how do you distinguish what is the abnormal newborn, newborn sepsis, respiratory distress syndrome, can you tell? So I will just give this to you right now. I'm gonna give you the ages, right? The ages matter. So if it's a preterm baby, it should be a preterm disease. If it is a term baby, it will be a term disease, most likely, right? Given some of those things. So when you're studying that. I'm just telling you right now, there's a question on hyperbilirubinemia and jaundice. I love that stuff. You need to know it. It's clinically relevant. There is a question on that. So everything backwards and forwards, everything to do with hyperbilirubinemia, you will need to know. Lecture 3 and 4 was then talking about newborn or kiddos as they are growing, their actual body growing, and then their functional development. So the same things with the objectives there. Can you read a growth chart? So if I'm giving you a growth chart or I'm explaining a growth chart, do you know what is normal, what is abnormal, how to read it, which chart it should be on, what might be wrong with that growth chart, what you should do about the growth chart? What are those normal parameters? Weight, height. How fast do you expect someone to grow? How fast do you expect them to double their weight, double their length? What are they going to look like in a year? What's a normal BMI percentile? Things like that. Anything to do with feeding issues. So we talked about breastfeeding, bottle feeding, we talked about infant nutrition under a year, we talked about juice, we talked about what to avoid, highly allergenic foods, all of the food things that you need to know. And then I'd hopefully beat into your head all the different screenings. So which ones are labs? Which ones are screening questionnaires? Which ones do you do at the same time? Which ones have those interventions and why? What are you trying to prevent there? And then that table, there's a table on the developmental one that has your gross motor and your communication. It has your fine motor and your problem solving and the other things, but it's circled on there, and I need you to focus specifically on gross motor and communication as your domains. There was a slide on red flags for development. That's a particular one. So if you know those red flags, and you should be able to kind of reason your way through what is normal then. In this lecture, I also talked about the well child check. So can you recognize a well child? And with that, what else do you do in a sports physical? So can you distinguish the difference between those two? Again, please do not memorize your immunization schedule. Do not at all memorize that. However, when you're going through some of those, what are those things that make certain vaccines unique? So the ones given at birth, the ones that are live vaccines, the ones contraindicated for certain things. So what are those unique things about some of these vaccines? And you're looking at the end of this one too, the safety counseling. There's those charts in the back. So at different ages, what is going to be important to counsel? Right, so we'll go through some of the examples of that. When do you talk to them about X, Y, Z for this? And I did post this just like 30 minutes ago onto block 1, so just 5 was looking at some of your congenital diseases. This one, this one is heavy fodder. I'll just tell you that because this is such an easy testable material for pants that they love. So some of these genetic conditions are ones that just especially to be aware of. In this one we talked about failure to thrive, so marrying that up with growth charts, so you know how to be able to distinguish that, get the diagnosis, and then understand what you're going to do about that. If I explained or gave you a picture of a certain type of genetic disorder, do you know what it is? Do you know how it's diagnosed? Do you know what you're going to, most common things that are going to be potentially a phenotypic expression in this person, or things you particularly need to screen for? So we'll go through some practice questions with that, and with particular ones, things like markers, fetal alcohol, but really any of them. Pick any of them to know those things. The developmental and behavioral stuff, what I need you guys to remember too, I'm not going to test you on things that you have already been tested on, right? So everything I'm testing you on is going to have a spin for pediatrics. So I'm not going to test you on things that Major McCampbell tested you on for psych, right? So like diagnostic criteria, it's going to have a twist for pediatrics. So the beginning of that one had normal versus abnormal, crying, what's normal, what's colic, temper tantrums, what's normal, what's not normal, having a stubborn child versus an oppositional defiant child, things like that. And then can you pick out the differences, the screening tools, your interventions for ADHD, for autism, for ODD, all of those different components. Adolescent, please just go over the heads exam again. What are the different components? When would you use that? What kind of interview techniques in general? My God, if that's not a 100% question, I don't know what I'm going to do. We talked about puberty, so I'm going to test it here for endo purposes. So for puberty, like I said, be familiar with the different SMR stages, so be able to understand that with picture or with a description, and be able to work forwards and backwards. What is the start of normal puberty? What is abnormal? We'll go through some of that. What are the ranges? What is true puberty? What are those mimickers of true puberty? All things menses. So what's that normal flow look like? What is abnormal? What is your interventions? First line, second line, third line. What do you do for those? We're going to talk about sports physicals, and then briefly with that mental health. Because remember, those are specifically different of what is FDA approved for kids versus adults. And then last but not least, child abuse had a lot of pictures, but really not that many objectives. So then you're looking at what are those risk factors for those kiddos, specifically again the red flags, so things that are going to should make you think, ooh, that's not normal. And then what are the patterns, right? So again, with a pattern, so if you see a pattern not normal, if you see an accidental bruising, where would you expect to see bruising? What would you expect to see fractured? What would you not expect to see in the child? Well, how might they be acting? What might your exam look like to be able to come up with what's likely an accident versus what is likely to be some sort of abuse. And the components of shaken baby syndrome, and then just briefly on reporting. What do you need to report? What do you not need to report? Things like that. That is my phone number. I will answer you on Canvas. I'll just answer you a lot quicker via text. If there are questions that come up throughout the week, please don't hesitate to text me or email me on Canvas or send a pigeon or whatever. I will answer you. Let's do some practice questions. Yeah, I posted these a little bit ago. Some of them are like I think better questions. Some of them are not as good. Just like okay, let's just walk through some of these together. Mother brings her infant. So how old is an infant? Yes, less than 1 year. Yep, with concerns of crying. She states that the baby cries all the time. Upon further questioning, you suspect that he may have colic. What goes with the diagnosis of colic? Is it more in the evenings? Is it more in males? More with bottle-fed babies? Resolves by 3 weeks or higher in high risk and low socioeconomic? Yes, A. So it is in the evenings. So does it matter if it's males or females? More common in breast or bottle? Doesn't matter. Resolves by 3 weeks of age? When does it typically resolve? So the diagnostic criteria is 5 months, but it typically peaks at the 6 weeks and resolves by 12 weeks usually. So specific things. And then higher or lower risk for socioeconomic? Yep. Father brings his infant son in for a scheduled well visit. On exam, he has a persistent head lag and poor overall head control. At what age would this milestone typically be achieved? So, when are you expecting to see that the head is all the way up? 3 months is your answer. Yep. What do you expect by 1 month? Yeah, not much. Right? They don't do a whole lot. What do you expect by 4 months? Some shoulder, head and neck control. What's at 6 months? What's your anchor? Sitting at 6, yep. So any of those, yep. So you can navigate those back and forth. When giving anticipatory guidance on when to start cow's milk, which of the following ages would be most appropriate for this to occur? 12 months. Yep. What are you talking about at 6 months? Solid foods. What are you talking about at 9 months? What do they start doing at 9 months? Crawling, so you're talking about like safety in the home because they're starting to move. 10 months is just there to throw you off because it's not a well check, things like that. What if instead of that I said, what anticipatory guidance for mom they want to start goat's milk? Can you do goat's milk? You can, it's not recommended though. Why? Yep, anemia. Which of the following is accurate regarding your CDC immunization schedule? Hep B is the only vaccine standardly administered at birth. True or false?
True.
True. Meningococcal protects against skin infections? No, false. What does it protect against? Meningitis. Influenza vaccine is recommended starting at 2 months. When is it recommended? 6 months, correct. And what's specific about influenza? That first year? Get 2. Yep. Rotavirus vaccine is an injectable vaccine. No, it is oral. Yep. And HPV is administered first starting at 16. False. Yep. Indicated down to 9. We usually give it at 1. That's why this one is a great question, because its indication of when we actually give it are different. You are performing a 3 to 5 day well visit physical exam on a healthy term infant, and you see the following on the exam. What is that you are seeing on this baby? Melia. Yep. What do you do with Melia?
Reassure.
You reassure. Yep. It is totally benign. You do not need to do anything. What is the following tool used to screen for ADHD? Vanderbilt. What is PHQ-9 for? Depression. What does it stand for? Patient Health Questionnaire. Good. What is ASQ? Ages and stages questionnaire, what is that for? Development, correct. Your MCHAT-R, autism. When do you do that? 18 and 24 months, correct. And your craft. Yep, substance abuse. So a lot of times they'll give you a long little stem, but really it's a first order question like that. A 3-year-old child presents with poor weight gain. Her weight is at the 2nd percentile overall and crosses 2 major percentiles. What already is your diagnosis? Yep, failure to thrive. Over the past 6 months, the family has kept all of their appointments in primary care and has tried to increase her caloric intake based on some online research they have done. However, they report she's a very picky eater. Which of the following is your most appropriate next step to work on? So you're going to do outpatient nutrition, inpatient admission, GI, development, or CPS? What is our consensus here? Do you think this patient needs outpatient or inpatient? Why do you think they need, which one? Man, I should have put this question on the test. Yeah.
I would say give her that outpatient one because they want to do better.
Yes, correct. So this is a patient that I would still stick with outpatient because they have not failed all of outpatient yet. So if I had put, they had done primary care, they had gone to the specialist, they had done all of this and they still weren't doing it, then that's an indication for admission. Or you're concerned for abuse, I need to admit for safety reasons. But if I'm going to do that outpatient then, what am I going to do? Am I going to do developmental? Is it giving anything about her function here? She's a picky eater. Anything else about her function?
I mean, it might be appropriate to refer a gastro because there's some sort of food problem and they use something in house.
So yeah, so that would be, that's really where you're going to get down to, in my opinion, when I wrote this, right? Is that you're going to get down to nutrition or gastro, right? So am I giving you anything for gastro? Is she ruminating? Is she vomiting? Is she having any malabsorption type symptoms? No. Is she a picky eater? Yes. So for picky eating and for some of those nutritional things, end up with dietitian or a nutrition consult versus GI. So watch for those things. What is my clinical question, right? So if I'm not giving you anything that would have any type of those GI symptoms, don't send them to GI. Maybe I should put this question. Which of the following events is typical start of puberty? True puberty in males.
Testicular growth.
Testicular growth, yes. And then what you will need to know, because I could ask this same thing, which SMR stage are any of these? So I could say, what is SMR stage 3? What is SMR 2? What is SMR any of those? Right, so that's how I can just forwards or backwards those type of questions. Which of the following locations is most consistent with an accidental injury bruising pattern on an ambulatory child? So accidents, bruising, and this child can walk. Shins, yes. What if this child was a non-ambulatory child? Yes, you don't have an answer here then, right? If you are not an ambulating child, you should have no bruises anyway. Which of the following is the most appropriate screening to perform for a given age? Do you do a hearing screen on all newborns after 2 weeks of age? When do you do a hearing? Do you do a hearing screen? Yes. When do you do? At birth, yeah. When do you need to make sure it's done by? 3 months, correct. Autism screening for all children 18 and 24 months of age. Correct. We're using what tool? A vision screener for all children no earlier than 1. 6 months, correct. Yep. So that would be correct, but down to 6 months. Anemia blood screening for all infants at 6 months of age. 12 months. And blood screening for all children at 18 months. 12 months for which one? For blood. What do you do before that? Questions at 6 months, correct. Okay, that's how I write questions very similar to that. So if you feel like you are good with those. Okay, last learning style. Okay, you guys ready? Here are today's categories. It's a baby. All the norms? That's not right. Why are you acting like that? Teenagers and non-accidental trauma. Somebody, let's pick a category. We'll just go down that category. Non-accidental trauma. Oh, we're just gonna start sad. Oh, whoops, sorry, we went to a different category. So sorry. What does APGAR stand for? Appearance. Oh, sorry. Appearance. Pulse. Grimace. Activity. Respirations. Correct. Appearance. Pulse. Let's go back to non-accidental trauma. True or false? The abdomen is a normal place for toddlers to bruise. False. I turned it down somewhere. Sorry. Correct. What are full body x-rays for children under the age of 3 called? Skeletal surveys, that is correct. Skeletal surveys. Are you just doing control find? Oh, I was like, that was fast. The clinical triad seen with shaken baby syndrome or abusive head trauma is retinal hemorrhage, subdural hematoma, and cerebral edema. Name 3 types of fractures that are highly suspicious for abuse. Spiral. What kind of rib? Posterior rib fractures. Yep. Okay, what else?
Bucket fracture.
Yep, bucket handle. Not bucket, but bucket handle fractures. Yep. Where else?
Femur.
Not necessarily femur, because kids are amazing at that. Scapula is one. Yep. What kind of
Oh,
non-linear skull fractures?
Sternum. Sternum.
Sternum. Yep. I think you guys got those. Yep. Posterior rib, sternal, non-linear, skull, scapular, spinous process. That's the other one. Good job. And a PCA nurse can do an exam within what time period?
72 hours.
72 hours. Correct. Pick another category. I heard it's a baby for someone too. It's not right. Oh, you guys already did APGAR. What does eyes and thighs mean? Erythromycin and vitamin K. What is the erythromycin for? Gonococcal conjunctivitis. What is the vitamin K for? It's preventing what? Vitamin K deficient bleeding. Yes. Which used to be called hemorrhagic disease in newborn. That's that much. Okay. I do not cross the suture lines. I can cause jaundice. I'm often associated with vacuum deliveries. What am I? Ceph what? Cephalohematoma. What's the other one? What's the one that everyone just gets because they got squished in the vaginal canal? Captain. Yep. And what's the scary one? So gaping. Correct. Describe the chest X-ray that you would see in a neonate with respiratory distress. So is respiratory distress syndrome a term problem or a preterm problem? Preterm problem. What is missing? Surfactant. What is that going to look like then? Ground glass. Yes. Ground glass appearance. Yes, on an X-ray. So what I could do also is just give you the X-ray and ask you how likely was this child, what was their likely age of birth. Something like that. Name at least 3 physiologic reasons for physiologic hyperbilirubinemia. So the normal kind of jaundice. Normal reasons why they would have elevated bilirubin. Why? So preterm makes it worse for sure. Not gestational diabetes. So that is physiologic. So that would be pathologic. So correct, that would give you hyperbilirubinemia, but that would be pathologic. What is the normal things that are going wrong or going poorly? How much milk do we have? Right off the bat. There's not a whole lot of milk going on, right? Was the liver really doing anything yet? No. Is the gut really doing anything yet? Do we have an increase or a decrease of red blood cell breakdown? Increase. Yes, we have a ton of different reasons, right? So if we're looking at this, the insufficient enzyme activity in the liver, one of your first reasons. You have that decrease in your gut motility and the decreased gut bacteria that's working on it. You have the decreased intake, which I have. Prematurity, someone said that. If you are exclusively breastfeeding, and that hasn't come on yet, and then certain altitudes, settings, races are going to be that worse as well. That's just an example. That's not right. Deficiency of weight gain only is which classification of failure to thrive? Wasting, type 1. Name the annual labs that you will need to get for a patient with trisomy 21. Do you get sleep apnea annually? And is that a lab? Heart is not a lab. Renal ultrasound is not a lab. TSH is correct as one of the 3. What else? CBC? And what's your third one? Not a CMP? Your iron studies. I would go back and study that section. DNA amplification looking for your CGG triplet repeats looks for which genetic syndrome? Not trisomy 21. Fragile X. Good job. 400. What is the underlying cause of infertility seen in Klinefelter syndrome? What doesn't work? What's not working? Seminiferous tubule dysfunction. Correct. A 14-year-old male comes to the ER with ectopic lentis occurring during a basketball game. And your attending asks for an echocardiogram. Why? So, if you see a child with ectopic lenses, ectopia lenses, right, displaced lens, and they're playing basketball, what do you think that their diagnosis is? dogs? Marfans. What are you looking for on that echo? Not necessarily a dilated cardiomyopathy. Not necessarily a dissected, right? That patient would be dead. Okay? The aortic root aneurysm. Yep. Dilated aortic root. So you're at risk for that dissection, but you have somebody there for a different reason. Good. Which one next?
Why are you acting like that?
Teenagers. What is your normal age range for puberty for both males and females? What is males? 9 to 14 for males, and females is 8 to 13. If you have an elevated DHEAS, what are you thinking your diagnosis is? No? So where does DHEAS come from? What organ? Your adrenal glands. Yes. It comes from your adrenal glands. Do you think it's turned on early or turned on late? Early. What is early adrenal gland turning on called? Is that true puberty? Is this precocious puberty? What is how else do you say early adrenarche? Premature adrenarche. We're so close. You guys you're doing great, guys. Okay, we already went through this with males. What is your first sign of true puberty in males? Testicular. What is it? Females? Breast bud development. Anything outside of those two are going to be premature something. Something else. What genetic syndrome should you evaluate for in the diagnosis of primary amenorrhea? Why is Klinefelter's wrong? Because yes, they are a man then, because they will not have periods. Correct. Turner's syndrome. Yes, I got really excited there. What is your diagnostic criteria of PCOS? Ovarian cysts are one of them. Clinical hirsutism or labs of hirsutism and something to do with amenorrhea. Menstrual irregularities or amenorrhea, correct. Nice. Okay, one of these two. Why are you acting like that? How many word phrases should a 2-year-old have? 2. A 2-year-old should be able to say 2 word phrases. Go outside, more juice. Play now. Or they'll just scream. One of the two. Oh, God, I hope you guys never forget this. I hope this is on your pants and you guys are just like, boom, next. One. A child is having repeated breath holding spells. What labs would you check? Can be normal, so it is normal. However, if they're doing it repeatedly, iron. Yep. Correct. CBC and iron studies. What type of therapy would a child with a diagnosis of autism spectrum disorder, what type should they be offered? This is actually a trick question. ABA is what they should be offered for the diagnosis of autism. However, this is a trick question because they often are in speech, occupational, and physical therapy as well. So, trick question. What's your difference between an IEP and a 504 plan?
One changes the curriculum.
Yep. Which one modifies, one adapts? Which one modifies? IEP, so that makes 504 plan your adapt. Last but not least, what is your recommended daily dose of vitamin D for infants? 400 what? Yes. And somebody asked me in the last couple of classes ago, this is oral, so vitamin K is injection, vitamin D is oral, so don't miss those little things. Oops. Well, there you go. Under the age of 2, which growth chart should providers be referencing? The WHO. Correct. True or false? For premature infants, their catch-up growth occurs in those first 12 months. It is false. Why is it false? 6 months. Correct. Correct. 400. What is the only absolute contraindication from an infant side to breastfeeding? Not an allergy. Galactosemia. Why is phenylketonuria not? So partial. Yep, so they can supplement. What are the 5 most common allergenic foods?
Peanuts.
Peanuts, we got it? Eggs? Shellfish? No honey. Meat? Where do you have eggs? Milk? One more. Wheat. Say wheat. Eggs, milk, soy, wheat, peanuts, shellfish. Good job. Last but not least, your final Jeopardy. Put the whole song on here, so sorry, it's so long. Just enjoy the music. Sway a little bit. S? T. We'll go back to the O-R. C? H. What else is in the O? Sure, E. coli. HIV. Hepatitis. Which hepatitis? B and C. Yep. Things like gonorrhea, chlamydia, parvo, all of those things. So we'll get into a lot of that stuff in block 2. So remember the O, because that's where we'll head back to, okay? I am out. Questions, comments, concerns, anxieties, frustrations? This should not, this is hopefully an idea of what things you will need to know to be able to answer the questions. So just knowing this will get you pretty far, but you need to apply some of this. Okay, so if you know this type level and then you can apply it, you should be okay. So again, block 1 is a lot of rote memorization. Yes, sir? No. It is, I think you guys recorded it though. Yes. It was recorded, but I'm not gonna post this one. Other questions, comments, concerns, anxieties, frustrations, griefs, miscellaneous toxicities, rejections. I didn't think it was that bad.
Got it.
Oh, I was like, I didn't think it was that bad.